Hello, welcome to Medical Ward BSN 3F Group 2, third rotation NCM 116 RLE, Nursing Care Management 116 RLE, Medical Surgical Nursing 2, Virtual Clinical Duty. This is our second week, and of course, our focus for this week is case scenario of patient CD diagnosed with Parkinson's disease. Of course, this will be our second week case analysis. But before that, let me share this premise to you. I am here for you. It's literally my life's work to help you grow. And also, please allow me to share with you our learning outcomes for this week. On completion of this case study, student nurses will be able to first build knowledge related to the patient's medical experience. Second, continue to develop a comprehensive assessment and monitoring skills. Third, recommend nursing interventions based on the case presented. Fourth, define the roles and the contributions of student nurses in the care of medical patients. And fifth, justify optimal therapy based on the current understanding of the case. And also, as a reminder for the instructions, all critical thinking questions presented within or after the case applies to this case study. You have to create a brief and to the point responses, no flowery words. When asked to provide several answers, it must be listed in order of priority or level of significance. Base all your answers on the data that is presented and do not assume information that is not provided in the case. Further, please follow the format of your output, especially on its font style, font size, paper margin, and paper size. Save it as PDF file and submit all your requirements per group on date specified as its deadline. Send all your requirements via the official email address of your clinical instructor. It is advised that you will submit all your requirements on or before the set deadline of submission. Furthermore, kindly follow this format in saving your requirements for easier monitoring for your daily requirements for the second week. Abang underscore Joseph underscore W2D1 NCM116 RLE for day 1. Abang underscore Joseph underscore W2D2 underscore NCM116 RLE for day 2. And of course, for your weekly requirements, Abang underscore Joseph underscore W2 underscore NCM116 RLE. Okay, let's now have your case scenario of patient CD diagnosed with Parkinson's disease. Case history. Patient CD is a 78-year-old man, married, a Protestant in faith, currently residing at Barangay Kamaman-an, Cagayan de Oro City. He is a retired engineer, married, and lives with his wife in a small farming community. He has 4 adult children who lives close by. Since his last visit to the clinic 6 months ago, CD reports that his tremors are about the same as they were. However, further questioning reveals that he feels his gait is perhaps a little more unsteady, and his fatigue is slightly more noticeable. CD is also concerned about increased drooling. His physician decided to admit patient CD in the medical ward of Maria Reina Xavier University Hospital for further evaluation of his case. His initial vital signs upon assessment are as follows: blood pressure of 130 over 75 millimeters mercury, heart rate of 85 beats per minute, temperature of 37.8 degrees Celsius, respiratory rate of 23 breaths per minute, and SpO2 of 89%. His physician ordered a CT scan with contrast and magnetic resonance imaging studies. Results of both CT scan and MRI studies showed an intracranial tumor at the basal ganglia. This data proves the diagnosis of patient CD's medical condition of Parkinson's disease. With this, his physician ordered the following medications: carbidopa, levodopa 25 over 100 mg or Cinemet, 1 tablet an hour before breakfast, and 1 tablet 2 hours after lunch; carbidopa, levodopa 50 over 200 mg, Cinemet CR, 1 tablet at bedtime, and amantadine, Semetril 100 mg at breakfast and bedtime. Patient CD was encouraged to try taking the carbidopa, levodopa, or Cinemet more times throughout the day, but he reports that he became very somnolent with that dosing regimen. He also reports that his dyskinetic movements appear to be worse just after taking his carbidopa, levodopa, Cinemet. As his assigned nurse of the day, you were able to reinforce your health teachings to patient CD about his current condition. About 4 days of hospitalization, his physician decided to discharge patient CD. Discharge teachings were formally given prior to the discharge of patient CD with emphasis on his medical regimen compliance. Let us now have your high 5 critical thinking questions. Number one, what is Parkinsonism? What is Parkinson's disease? Again, what is Parkinsonism? What is Parkinson's disease? Number two, what are the clinical manifestations of Parkinson's disease? Which of these symptoms did patient CD manifested? Again, what are the clinical manifestations of Parkinson's disease? Which of these symptoms did patient CD manifested? Number three, patient CD's wife asks you, how do doctors know CD has Parkinson's disease? They never did a lot of tests on him. How is the diagnosis of Parkinson's disease made? Again, patient CD's wife asks you, how do the doctors know CD has Parkinson's disease? They never did a lot of tests on him. How is the diagnosis of Parkinson's disease made? Number four, patient CD's wife comments, I don't even know which one of these medicines he takes for his Parkinson's. What medications are used for Parkinson's disease? Again, patient CD's wife comments, I don't even know which one of these medicines he takes for his Parkinson's. What medications are used for Parkinson's disease? Number five, levodopa is always given in combination with carbidopa. Why? Number five, levodopa is always given in combination with carbidopa. Why? So please answer these questions, and of course you have to submit that one at the end of this week. Let's now have the daily requirements for your for day 0 Sunday case scenario loading. That is gonna be March 28th. For day 1, Monday, the basic requirements, your GO, SO, DPA, Serial 1, Nurse's Notes, and after 1. Initial knowledge about the case, physical assessment, pathophysiology, diagnostic tests, and drug study. For day 2, that's Tuesday, that's March 30. Basic includes your SODPA, Series 2, Nurse's Notes, FDAR 2, weekly evaluation, reflective journal reading, critical thinking and answers, and of course your initial knowledge about the case that includes your problem list, nursing care plan, and also your discharge plan. For the weekly requirements, I know you know this one already. You have to have your introduction, nursing health history, physical assessment, anatomy and physiology, pathophysiology, diagnostic test, drug study, problem list, nursing care plan, discharge plan, learning outcome, and of course your references that has to be on an APA format. Deadline of submission for these requirements: day 1, March 29, 2021, Monday, 11:59 p.m. Day 2, March 30, 2021, Tuesday, 11:59 p.m. And of course, your weekly requirements, the deadline is April 3, 2021, Saturday, 11:59 p.m. We are all on our own journey, but in this class, we all need one another and will help one another grow. These are my contact details, my email address, my phone number, my social media accounts. This has been Joseph Bahian Abang at your service to make your best even better. To God be all the glory.